There are many well-known risk factors for heart disease that can later cause a heart attack, like excessive smoking, excessive drinking, high LDL cholesterol, obesity, etc. But did you know that too much exercise can also cause a heart attack? Well, that's rare, but in fact, it can happen. Just like too much exercise, there are many hidden sources of heart attacks that you probably never considered. Let's get to know more about that. Number 1. Chronic stress. Many people hardly care about the stress they could be going through on a daily basis. But if you are taking too much stress and too often, it can become chronic. This kind of stress is way more dangerous and can even cause a heart attack if you don't take steps to reduce it. Basically, chronic stress triggers the release of stress hormones like cortisol and adrenaline, which can lead to an increase in blood pressure. High blood pressure puts strain on the arteries, making them less flexible and more prone to damage and plaque formation. Not just that, but cortisol and adrenaline hormones also trigger the release of sugar in your bloodstream to get you ready for a fight-or-flight response. Consistently high blood sugar can increase inflammation in your arteries and even in your heart muscles. Chronic stress can also badly affect the sympathetic nervous system, causing an increase in heart rate and potentially triggering abnormal heart rhythms. It means that too much stress can disrupt electrical signals in the heart and increase the risk of having a heart attack. Additionally, many people consistently going through chronic stress often tend to adopt unhealthy habits such as smoking, excessive alcohol consumption, overeating, or lack of physical activity. These behaviors can further contribute to heart disease and increase the risk of having a heart attack. Another prominent reason is that chronic stress can affect blood clotting factors and promote the formation of blood clots. If a blood clot forms within a coronary artery, it can block the blood flow to the heart muscle and result in a heart attack. And that's why it's very important to manage and reduce chronic stress. You can do that by doing regular exercise, having a healthy diet and lifestyle, and doing relaxation techniques like yoga, meditation, dancing, and as convenient as doing deep breathing exercises for a few minutes. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Sleep apnea. Sleep apnea is a major sleep disorder that often comes with repeated pauses in breathing or shallow breathing during sleep. During episodes of sleep apnea, your breathing passages can become partially or completely blocked, leading to decreased oxygen levels in your blood. This condition is known as hypoxia, and it can strain the heart and increase your risk of having a heart attack. Additionally, sleep apnea is also linked with hypertension or high blood pressure. Repeated pauses in breathing and suddenly getting up after an apnea can trigger a stress response. This can increase your blood pressure and heart rate, putting a sudden and additional strain on your heart. Over time, this can contribute to the development of heart disease and sometimes cause a heart attack. Not just that, but sleep apnea can also disturb the electrical activity of your heart, resulting in arrhythmia or irregular heartbeat. These abnormal heart rhythms can reduce overall heart efficiency, leading to a higher risk of having a heart attack. So if you often experience episodes of sleep apnea or suddenly wake up in the middle of the night, it's best to consult your health specialist, as it can be a hidden source of heart attack that you may have never considered. Number 3. Overexertion during exercise. What many people don't know about strenuous exercise is that overexertion during physical activity can actually cause a sudden heart attack, particularly for people who already have heart disease. In fact, recent studies show that doing high-intensity exercise beyond your capacity or limits can increase the risk of sudden cardiac arrest. This is mainly because overexertion can lead to excessive sweating and fluid loss, which can result in dehydration and electrolyte imbalances. Electrolytes, such as potassium and sodium, play a key role in maintaining the proper functioning of the heart. Imbalances in these electrolytes can disturb the heart's electrical activity and increase the risk of having a heart attack, especially for people with underlying heart disease. To avoid this risk, try to not work out beyond your limits and stay within the safe range of your maximum heart rate. Maximum heart rate depends on many factors like age and your fitness level. A general rule to calculate your maximum heart rate is to subtract your age from the number 220. So if you have 30 years of age, then your maximum heart rate would be 190. Your target heart rate should not be more than 75 to 85% of this value. So if you are 30 years old, your target heart rate should not exceed 162 beats per minute. You can use wearable heart rate monitors or fitness trackers to check your heart rate during your workouts, or manually check your pulse at regular intervals during your workout. This can help you stay within your target heart rate zone and adjust the intensity of your exercise accordingly. Number 4. Dental health. You might be least expecting this, but your dental health is closely related to your heart health. Studies show that poor oral hygiene and gum disease are linked with an increased risk of heart disease and, in some cases, a heart attack. For example, gum disease, also known as periodontal disease, is caused by bacterial infection and inflammation of the gums. The same bacteria present in gum infections can enter the bloodstream through inflamed gum tissues, leading to inflammation in the arteries. This inflammation can trigger the development and progression of atherosclerosis, the buildup of plaque in the arteries, that can lead to heart attacks. Therefore, it's important to maintain good oral hygiene by brushing your teeth twice a day every day, and regularly visiting the dentist for professional cleanings and checkups. Number 5. Shift work. Can you believe that your late-night shift work or irregular working hours can increase your risk of having a heart attack? The disruption of your body's natural circadian rhythm and sleep patterns can dramatically affect your overall heart health. Working for those extra hours for extra money requires you to work during the time you were supposed to sleep. This can lead to chronic sleep deprivation, poor quality sleep, and an increased risk of getting sleep disorders like insomnia and sleep apnea. All of these things are indirectly related to an increased risk of hypertension, obesity, type 2 diabetes, and other conditions that can later give you a heart attack. Our body's internal clock, also known as the circadian rhythm, regulates many physiological processes, including blood pressure, heart rate, and hormone levels. Extra shift work disrupts this natural rhythm and can lead to increased blood pressure, impaired glucose metabolism, and dysregulation of stress hormones. So it's best to manage your working hours and get proper sleep and rest. After all, health is more important than too much work, right? Number 6. Climate extremes. Sometimes climate extremes, both hot and cold, can silently contribute to the development of heart disease and sometimes even heart attacks. During the hottest times of summer and heat waves, high temperatures can lead to dehydration and increased fluid loss through sweating. This can result in a decrease in blood volume and an increase in blood viscosity, making the blood thicker and more prone to clotting. Heat waves can also lead to vasodilation, the expansion of blood vessels in an attempt to cool the body, and that can lower your blood pressure. These changes in blood thickness and blood pressure can increase the strain on your heart and potentially trigger a heart attack, especially if you already have an underlying heart disease. Similarly, extreme cold temperatures can cause vasoconstriction, the narrowing of blood vessels to conserve heat and maintain body temperature. This constriction can effectively increase your blood pressure and overall workload on your heart. Extreme cold temperature is also indirectly linked with a high risk of developing blood clots of the blood vessels, which can reduce blood supply to the heart and increase the risk of having heart attacks. So it's best to maintain your body's temperature, especially in extremely low or extremely high temperatures. Thank you for watching and subscribing to the channel. See you in the next video.